So, we've already talked a little bit about sort of the numerous medical nursing needs that are necessary within our own home. And certainly, I think when I think about the families, not just mine, but all the other families in New Mexico who decide to take this on, and this really is a labor of love. They are more than willing to receive the training. They're more than willing to do what needs to be done to keep their child safe with the highest quality of life possible, pain-free, etc. There was, earlier in the conversations there was a little bit of the sort of this hypervigilance that the caregivers, would be it mom or dad or a family member who's being the caregiver for that moment. And certainly Jen alluded to the overnight, right? You're sleeping, you always sleep with one eye open, one ear listening. If my son made a little bit of a sound, you always had to wake up enough to say, is that an okay sound, or do I jump out of bed and make sure he's okay? And that is this sort of constant hypervigilance, 24/7, 365 for extended periods of time, right? Yeah. For my home, it was 13 years. For others, it's been 30 some odd years or longer. You have no idea how long it will be for. And I can tell you that I will be happy to have done this for another 30, 40 years to have my son here. So all of that is just, I just wanted to kind of sum that up. Because children are so-called living longer, right, due to medical advances, that's usually what gets credit for this. I think the other piece that I would love to mention is that credit also goes to these caregivers, to the parents doing this at home. As you've already mentioned, some of these individuals are not just giving medications, but they're managing ventilators, they're managing feeding pumps, they're imagining, oxygen, it just, the list goes on and on in terms of specialized medical equipment. So I think there is sort of some credit there needs to be given to the caregivers at home. The possible solutions, I like the solution you've mentioned in terms of a family trained, whether it's the parent or a family member to do this. I think that would be a wonderful solution for many. Probably not all families, right? Because so many families are so different and have so many different needs. But different families find different ways. One of the things that's always brought up in terms of sort of, I mentioned earlier, the Medically Fragile Waiver, it is supposed to be in place to sort of supplement and support the community supports that are in place and the natural supports that are in place. But in and of itself, it does not meet all the needs of the families. So I think we have to be very creative. I think we have to be open-minded. Your solution is one of I think would be a wonderful solution in New Mexico and would have been helping a lot of families in our state, especially when we get out to the rural parts of our state. And New Mexico is a rural state, right? So we are either left without any help at all. Sometimes if we can have, for example, a home health aide, which is certainly something that in our home we considered, that would have been very difficult for us in terms of usually home health aides are not able to administer medications, and my son had multiple medications throughout the day. So it's hard to leave your child when you have to be back in 20 minutes, in an hour to give the next medication. The other piece, and I'll let Jen speak a little bit more to this piece and why one of the biggest missions or goals for Heroes Path is that of respite care. And I know Joy brought that up a little bit as well in terms of respite care. New Mexico does not really have any agencies that can provide respite care for children who are medically fragile, individuals, regardless of age. We simply don't have it. It is a service that's available to us through the waiver program. We simply don't have anyone to provide it. And respite care would literally provide the much, much needed sort of relief, if you will, from being the caregiver 24/7, 365 for year after year. And I will let Jen speak a little bit more to the respite care piece, since we don't have it really available. It may be on the list of menu of services, but we really physically don't have access to that.